Friends, topic of today is cancer prevention. Cancer is associated with physical problems, emotional stress, and high cost of care, and hence prevention is necessary to lower the risk of getting cancer. Control of risk factors reduces the risk of development of cancer. Broadly, risk factors can be divided into three: genetic factor, environmental factor, and lifestyle factor. We have no control over genetic factor, but environmental factor and lifestyle factor can be modified. I will discuss about it. I will also tell a few words about screening for early detection of precancerous and cancerous conditions for better prognosis. These are the warning symptoms for which medical consultation is required. Symptoms can be memorized by mnemonic: caution, C for change in bowel or bladder habits, A for a sore that doesn't heal, U for unusual bleeding or discharge, T for thickening or lump in the breast or elsewhere, I for indigestion or difficulty in swallowing, O for obvious change in a wart or mole, N for nagging cough or hoarseness. Lifestyle changes have a great role in prevention of cancer. Avoid smoking and tobacco use. Smoking is associated with mouth, throat, lung, and bladder cancer. Tobacco is associated with mouth cancer. Be more active, exercise regularly. Moderate activity includes walking, doing yoga, and even gardening. It prevents obesity and lowers growth factor, which is associated with cancer development. Limit alcohol intake. Alcohol raises the risk of liver cancer. Healthy diet. Emphasis should be on vegetables and fruits. If the person is non-vegetarian, fish or chicken may be taken. Avoid red meat. Fast food should be avoided. Ideal body weight. Being overweight has risk for breast and colon cancer. Stand up more. Sitting for a long hour is an unhealthy lifestyle and associated with different types of cancer. Be sure to stand up and walk around every 2 hours. Regular medical care with routine test. Avoid risky behavior like unsafe sex or sharing needle. By unsafe sex, one may get HIV or human papillomavirus infection. HIV infection is associated with multiple malignancies. One of them is non-Hodgkin's lymphoma. Human papillomavirus is associated with cervical cancer and genital warts. By sharing needle, one can get HIV infection or hepatitis B virus infection or hepatitis C virus infection. Hepatitis B virus and hepatitis C virus may cause liver cancer. Breastfeeding lowers the risk of breast cancer. Regarding environmental factors, protect your skin and body parts from radiation. There are two main types of radiation linked with an increased risk of cancer. First is ultraviolet radiation from sunlight, which causes skin cancer. Second is ionizing radiation. Hence, use of X-rays, CT scans, fluoroscopy, and nuclear medicine scans should be used with justification. Get vaccinated for human papillomavirus and hepatitis B virus. Human papillomavirus is a sexually transmitted virus that can lead to cervical cancer and genital warts. Vaccination should be given to males and females of age 9 to 45. Hepatitis B virus vaccine is for healthcare or public safety worker who might be exposed to infected blood or body fluids. Avoid exposure to industrial and environmental toxins like air pollution and indoor smoke from household by use of solid fuels. Avoid infection, particularly chronic infection or inflammation. Chronic inflammation can cause DNA damage and lead to cancer. Immunosuppressive medicines after organ transplant are associated with tumor formation. Prostate cancer screening by prostate specific antigen PSA. PSA is a tumor marker of carcinoma prostate, which is generally a slow growing tumor. The test should be done after consultation with urologist who will assess the risk factors and benefits of the test. If PSA level is less than 2.5, test should be done after 2 years. If PSA level is 2.5 nanogram per milliliter or higher, screening should be done yearly. The test is accompanied by digital rectal examination. Breast cancer screening age is 40 to 65 years with clinical breast examination and mammography for women age 45 and older. Frequency of screening 2 years. In case of suspicious lesion, ultrasonography, FNAC or core biopsy may be done. Cervical cancer screening age is 30 to 65 years. Frequency of screening 5 years or more by visual inspection with acetic acid, human papillomavirus DNA test, pap smear examination. This is a cytological examination to detect precancerous lesions. In case of precursor lesion, cryotherapy or loop electrosurgical excision procedure should be done. Oral cancer screening by oral visual inspection. Target group is person using tobacco, alcohol or areca nut. Target screening is 15 years or older. Frequency of screening 2 to 5 years. In case of suspicious lesion, oral breast biopsy or punch biopsy or excision biopsy should be done.